When you pass 50, your heart story becomes the most important one. Do you know the hidden enemy that strikes 380,000 seniors every year when they are completely alone? It's not just a statistic, it's a terrifying reality. But what happens when the heart you rely on sends out a silent warning? We spend our golden years building memories. But are we truly prepared for the biggest threat to them? In a moment of crisis, when panic sets in, the wrong action can be fatal. Today, we're cutting through the myths to deliver 7 scientifically backed tips. These aren't just tips. They are the 7 steps trained paramedics wish every senior knew. We'll reveal the single most common mistake almost everyone makes with aspirin, and a breathing technique so powerful it calms your nervous system during the peak of an attack. We will show you exactly what to do and in what order to buy yourself those critical minutes. Stay with us. This one video is the emergency plan your family needs you to have. Let's start with the foundation. The first signal you absolutely must not miss. Life doesn't slow down, but our hearts change, especially after that pivotal age of 50. Cardiovascular risks multiply, often without us realizing the ticking clock inside. Preparation isn't about fear, it's about empowerment. It's about knowing your battle plan. Because when a heart attack strikes alone, you are your own first responder. These steps will feel second nature if you practice them now in a moment of calm. We can dramatically improve survival rates, but it requires immediate, correct action. This video is your blueprint. Print it out, memorize it, and share it. Time is muscle. Every minute wasted means irreversible damage to your heart. We need to act decisively within the first 60 seconds to maximize your chances. Hit the like button if you want to protect your heart and the hearts of those you love. Let's dive into the first life-saving tip, one that many overlook until it's too late. We are talking about self-assessment under pressure. It is a trainable skill. Knowing the exact emergency number is just the beginning. Knowing when to call is everything. Listen closely to the order of these steps, because the sequence is what truly saves lives. From recognizing the whisper of a symptom to taking the right medication, we cover it all. This information is too valuable to keep to yourself. Commit to sharing it after this video. We're starting the countdown. 7 steps to securing your future and protecting your heart health. Let's ensure you are not one of the statistics. Let's make you a survivor. Starting with tip 1, the silent language of an aging heart. Tip number 1. Learn to spot the subtle, atypical heart attack signs in older adults. For seniors, the classic crushing chest pain is often replaced by quieter, more deceptive symptoms. Look for sudden, unexplained shortness of breath or discomfort radiating to the back, neck, or jaw. Unusual fatigue, dizziness, or a feeling of indigestion can mask a deadly coronary event. Studies show over 40% of seniors experience no chest pain at all during a heart attack. Cold sweats, nausea, or lightheadedness are often the only clues your body gives you. If you feel a sudden, inexplicable weakness that prevents normal movement, take immediate notice. A feeling of severe heartburn or stomach pain, especially after mild exertion, can be cardiac-related. Acute confusion or sudden mental fogginess signals a critical drop in oxygen to the brain. If you have a history of diabetes, your risk for silent heart attacks is significantly higher. The feeling may be just pressure, tightness, or an uncomfortable fullness, not stabbing pain. Women often present with non-pain symptoms, like extreme fatigue or sleep disturbances in the preceding weeks. Sudden nocturnal shortness of breath, waking up gasping, is a dangerous sign that requires evaluation. Do not dismiss your symptoms as just getting old or indigestion. When in doubt, call for help. If you monitor your vital signs, note any drastic, unusual changes in blood pressure or pulse. Your body is giving you a warning. Recognizing it is step 1. Acting on it is the key to survival. The first response to recognition is stopping all activity. Sit down immediately. Keep this simple checklist in your mind. Atypical symptoms are the norm for seniors. Time is critical. Try to note the exact time symptoms began, information for the paramedics. The moment you suspect anything at all, your next action must be Tip 2. Moving to Tip 2, the critical mistake everyone makes with over-the-counter medicine. A calm mind allows for correct action. Panic costs time and oxygen. Being alone doesn't mean you are helpless. Knowledge is your most powerful defense. This is your moment to take control. Let's move to the immediate aspirin protocol. Tip 2 is the most critical immediate action involving medication, the aspirin protocol. Forget what you think you know. You must chew the full dose 325 milligrams, not swallow it. Chewing allows the drug to enter your bloodstream 50% faster, immediately stopping the clot from growing. That difference of 10 to 15 minutes is literally the difference between major
Charge to
damage
200.
and survival. Crucially, use non-enteric coated aspirin. The coated versions take too long to dissolve. If you only have coated aspirin, you must still chew it. The awful taste is worth your life. The correct dosage is 325 milligrams. This is usually 1 regular strength pill or 4 baby aspirins. Aspirin makes your platelets less sticky, preventing the blood clot from enlarging inside your artery. Keep immediate release aspirin in multiple locations: your bedroom, kitchen, and even your wallet. Check the expiration date every 6 months. Expired aspirin loses its potency when you need it most. Do not take aspirin if you are severely allergic or are already on certain strong blood thinners like warfarin. Once the aspirin is chewed and swallowed, time is still your enemy. Move immediately to the next step. Ensure you chew it completely. The surface area is key to rapid absorption. Research shows taking aspirin within the first hour can reduce death rates by over 20%. If you take a daily low-dose aspirin, 81 milligrams, you still need the full 325 milligrams dose for an acute attack. Avoid drinking water immediately after chewing, as you want the residue to absorb sublingually. This simple act buys the paramedics precious time to clear the blockage professionally. Maintain composure. Every action should be deliberate and focused on rapid absorption. Next, the critical sequence. Tip 3. Call first, then action. You have slowed the clotting. Now, you must secure professional intervention. Do not waste time searching for the bottle. Know where your aspirin is stored beforehand. Remember the rule: sit down, chew aspirin, and then immediately proceed to call for help. Now, let's synchronize this action with the emergency call. The precise order of action matters enormously. Tip 3. Implement the critical 3-step sequence that saves crucial minutes. The first step is always to establish contact with emergency services even before taking medication. Your brain is losing oxygen quickly. Call immediately while you can still communicate your location clearly. As soon as the call is connected, proceed directly to the aspirin protocol we just discussed. And the often forgotten third step: ensure the paramedics can get to you without delay. Be precise. State clearly that you are having chest pain, symptoms of a heart attack, and your exact address. Pre-writing your address is essential. Do not rely on your memory during an oxygen-deprived state. Use speakerphone if possible. This frees your hands for other actions and keeps the dispatcher informed. Your continuous communication helps guide the crew and prepares them for your condition. Do not hang up the phone until the paramedics are physically at your side or the dispatcher tells you to. Always step 1. Calling ensures that professional help is already mobilized and on its way. Taking action provides a sense of control, which naturally helps reduce the initial panic. Have your medical ID, allergy list, and current medications ready to give to the crew immediately. With help on the way, your focus shifts inward. Tip 4. Mastering the breath. If you live in an apartment or gated community, state your unit number and gate code to the dispatcher. Remain seated or in the most comfortable position possible while talking to the dispatcher. After the call and aspirin, your next priority is making entry for the paramedics seamless. The dispatcher is your lifeline. Treat them as the vital first connection to the hospital team. Keep the phone within sight, even if you move to a more comfortable position. We move now to tip 4, a non-medical technique that controls your internal chaos. You have done the essentials. Now, focus on managing your body's oxygen needs. Simple reminders keep you on track. Do not rely solely on panic memory. Your breathing can be your best friend or your worst enemy right now. Tip 4 deals with the body's natural enemy during a heart attack: hyperventilation and panic. Rapid, shallow breaths increase your heart rate and your heart's demand for life-saving oxygen. We introduce the anti-panic box breathing technique to calm your vagus nerve and slow your heart. Breathe in slowly through your nose for a count of 4, feeling your diaphragm expand, not your chest. The long, slow exhale for a count of 6 is the key to signaling your body to relax and slow down. Ensure your belly, not your chest, moves with each breath. This is diaphragmatic breathing. Slowing your heart rate by even 10 beats per minute significantly reduces the heart's oxygen demand. Controlled breathing has been proven to lower blood pressure and heart rate during acute distress. Focus on the counting. Let the numbers anchor you and distract you from the panic signals. Count out loud if you can. It helps you maintain the rhythm and reassures the dispatcher that you are conscious. Practice this breathing technique daily, even when healthy. It's an essential muscle memory. Do not stop the controlled breathing until the paramedics take over. It's your ongoing support system. If you are struggling to maintain the rhythm, simply focus on the long, slow exhale. The exhale is the most critical part, as it activates the calming side of your nervous system. Loosen any tight clothing around your neck and waist to assist this deep breathing. You are actively combating the panic-induced effects on your heart muscle. Your ability to focus now will directly correlate with less heart muscle damage. With your internal state managed, let's address the final external barrier. Tip 5. The door is the last obstacle between you and professional medical care. Breathe, focus, and prepare to move slowly toward the entrance. This rhythm is your anchor until the ambulance siren gets closer. Ensure your emergency resting spot is always close to your entry point. Tip 5 addresses the deadly delay. Prioritize unlocking your front door immediately. Statistics show that a locked door can delay treatment by an average of 11 critical minutes. The moment you feel symptoms, use your last bit of coordination to unlock the door or leave it slightly ajar. Once on the floor, you cannot get back up. Unlocking the door must be one of your very first actions. Consider a key lock box and register the combination with your local fire department or EMT services. Turn on every single light in your house. A blazing house signals immediate emergency and saves search time. Paramedics look for the house that stands out. Visibility is a time-saving signal. During the day, hang a bright-colored item, a towel, or sign on the front door to grab attention. After unlocking, return to your safe resting position immediately. Do not attempt to wait outside. Tape a complete emergency information sheet to the inside of the door at eye level for quick reading. If you have a smart lock system, set up an emergency code for first responders or use voice control. A smooth entry is non-negotiable. Remove all obstacles from the path between the door and your resting spot. Keep a loud whistle near your bed or resting area. Sound is a final, simple signal if you lose consciousness. Ensure the dispatcher knows the door is unlocked and that you are waiting inside. If you live in an apartment, notify building security or a trusted neighbor to meet the EMTs. Reducing entry time from 10 minutes to 0 is one of the biggest survival factors you control. Clear a pathway from the door to your location. Every second counts for a rapid assessment. The path is clear for the rescuers. Now, focus entirely on your body. Tip 6. Relief that the external work is done allows you to concentrate on your physical state. Do not wander. Stay put in your designated safe spot after unlocking the door. Tip 6. Adopt the correct body position to maximize blood flow and minimize heart strain. Do not lie flat on your back unless you are actively fainting. This can make symptoms worse. Instead, Sit up at a 45-degree angle, the semi-Fowler's position to let gravity assist your breathing. This position helps your diaphragm expand fully and prevents fluid from backing up into your lungs. If dizziness or fainting strikes, gently lower yourself to the floor and lie on your side, not your back. Immediately loosen any restrictive clothing, belts, ties, tight collars, or tight waistbands. The upright position reduces the risk of pulmonary edema, a complication in heart failure. Use pillows, a wall, or the back of a couch to maintain that optimal semi-Fowler's posture. Patients in the correct cardiac position have measurably higher blood oxygen levels. Focus on stability. This position is designed to keep you conscious and breathing effectively. If you are sweating, avoid bundling up. Overheating increases the heart's workload. Keep the environment cool. Open a window for fresh air, but do not move outside. The bent knees help reduce pressure on your abdomen and assist diaphragmatic breathing. Avoid unnecessary movement. Every twitch requires energy that your heart cannot afford to spend. The recovery position, lying on your side, is vital if you lose consciousness to keep the airway open. You have mastered the environment and the body position. Tip 7. For those prescribed, master the immediate nitroglycerin protocol. It's a powerful tool, but only if used correctly and never while standing up. Sit down immediately to prevent a fatal drop in blood pressure and place one tablet under your tongue. Do not swallow it. Let it dissolve completely for maximum, fastest effect. You might feel a tingle. Set a 5-minute timer. If symptoms persist, take a second tablet. Another 5 minutes, take a third. Nitroglycerin loses potency quickly. Write the opening date and replace the bottle every 6 months. Always store it in the original, dark glass container. Never transfer it to a pill, organizer, or plastic box. The widening of your blood vessels instantly reduces the pressure your heart is fighting against. Critical warning. If you have taken ED medication, like Viagra, in the last 48 hours, do not take nitroglycerin. The combination can cause a fatal drop in blood pressure. Paramedics must know about this interaction. For maximum benefit, always chew your aspirin first, then take the nitroglycerin dose. The synergy between these two drugs provides the greatest chance of minimizing heart damage. Keep small quantities in multiple, easy-to-reach locations. Time spent searching is muscle lost. If you feel the tingling or a slight headache, it means the medication is active and working. Inform the dispatcher exactly when you took the first and subsequent tablets of nitroglycerin. This final step of medication preparation completes your immediate action plan. Keep the bottle handy. Paramedics will check the exact dosage and expiration. Self-advocacy and precise action are your most valuable assets in this emergency. The 7 life-saving steps are complete. Now, the doctor's final, emotional advice. You have done everything right. Be proud of your preparation and focus on holding that calm state. The focus now shifts from action to preservation and waiting. Wait for the sound of the siren, knowing you have successfully bought valuable time. The cavalry is coming. You survived the waiting game. Tips buy you time. But the best time to prepare is right now, when you are healthy. Practice the breathing. Check your medications monthly. Have your plan printed and visible. Your heart is not just an organ, it is the engine of your life. Treat it with the respect it demands. Think of your loved ones. Being prepared is the greatest gift of security you can give them. We hope you never face this scenario alone, but if you do, you now have the knowledge to fight. Early intervention and proper technique dramatically reduce the size of heart muscle damage. Your preparation impacts not just survival, but your quality of life after the event. This is your success story. Share your commitment to health with your family today. Print the summary of these 7 steps and place it next to your aspirin and phone. The locked door, a metaphor for lack of preparation, is now wide open for hope. Take control of your health narrative. Do not leave your fate to chance. Subscribe to our channel for more vital information tailored to senior health. Sharing this video is an act of love. You might save a life just by clicking that share button. Make preparedness a daily, non-negotiable routine, like brushing your teeth. Thank you for investing this time in your survival. Your life is worth the preparation. Check out our next videos on managing high blood pressure and cardiac-friendly diets. Stay healthy, stay safe, and be prepared. We'll see you in the next video. Your heart deserves the best defense. We provide the knowledge. This is the image of a survivor, calm, prepared, and informed. Remember the sequence: call, chew, unlock, breathe, position, medicate, wait. Embrace your golden years with confidence, knowing you have a plan. Be ready.